Hey everyone, we are live again here from the University of Florida at the Fixel studios at the Norman Fixel Institute, broadcasting for the awesome Parkinsons Foundation. And we've been doing this live throughout the entire Corona COVID-19 crisis and pandemic, and it's been awesome. And we've really enjoyed everything that we have been able to offer to the community. We've enjoyed the interactions, and it's been really terrific. And today we're talking about, well, life without the COVID-19. And so, what will life look like with Parkinson's after the COVID-19 vaccine and after lots more people get vaccinated? And I know this is a topic that everyone is super excited about. What's happening now with the surge in vaccines in the United States, and hopefully countries around the world are going to follow. And so we really want to take your questions, and it's been great because we've already received a whole bunch of preliminary questions about COVID-19 and about things that you want to know about. So I wanted to just tell you a couple of things. First of all, April is Parkinson's Awareness Month, and I want you to be completely aware and know that there's so many different things that you can get involved with, and we have so much in terms of all of the information that's free to you at Parkinson.org. And particularly for Parkinson Awareness Month, we've got the awesome Kathy Whitlock, and we've got the awesome Leilani Pearl, and they have prepared a whole bunch with their entire team at Parkinson.org/awareness. And so we want you to take advantage. This is really some awesome stuff. Also, for COVID information, all the latest information for the Parkinson's community about COVID-19 is also available, everyone, and can be found at parkinson.org/COVID. And also, you'll see all of the previous Facebook Lives that we've done together, but lots more information. The Aware and Care Hospitalization Kit, super important, particularly in the COVID era. If you head into the hospital for any reason, whether it's an elective surgery or you're sick, or, we hope you don't have COVID-19, but if you have COVID-19, this can help you to get your medicines on time every time if you're in the hospital for a planned or an emergency visit. You can order your kits at parkinson.org/store that we've given out over 100,000 of these. Really awesome stuff. You should definitely get your kit. And finally, at PD Health at home, we're continuing this popular online programming with new Mindfulness Mondays, Wellness Wednesdays, and Fitness Fridays every week. See what's coming up and check at parkinson.org/events. So again, go to the main Parkinson website, parkinson.org, and then you can flip around for Parkinson Awareness Month. It's /awareness. For COVID, it's /COVID. For the store, it's /store. And remember, that's where you can get your Aware and Care Hospitalization Kit. And then for all of the different things that happen on the different days of the week, look at /events. And so it's really great, and I want to welcome everyone. Now, our comment box is open. We're taking comments from all over the world, and one of the most awesome things about this is that we see your comments live, and we will answer them live, and we'll answer anything. We don't shy away in any of the questions. And so when we're talking about living in this vaccine era and what things are going to look like, we want you to know that you are important to us and you've been stuck at home, and so vaccines are one of the things that's going to help a lot. And many of you may know, but I'm also a neurologist by training, and so I see a lot of folks who have Parkinson, and we have seen categorical, just in general, lots of worsening, with Parkinson during the COVID-19 pandemic. And that's because people have been stuck at home, and they've been stuck without the ability to seek care, to get to the exercise groups, to get to the support groups. And so we're really going to have a great opportunity to be able to address a number of these things. And so I want to start out and take the first question. And this is from Rick from West Virginia. So West Virginia, you're on the board first here with the first question today. Thank you, Rick from West Virginia. Rick is asking us, how do you know what the long-term effects will be from the experimental shot, from the COVID-19 shot. How do you know what the long-term effects are going to be? Okay, Rick, well, it turns out that it's all about the data. So it's all about the data. And in the beginning, when we started to do these Facebook Lives, guess what? We didn't have a lot of data to give you. Now we're really beginning to get the data. So we have data on hospitalizations of people going in with Parkinson. We have data on safety. And at first, we could only offer you, Rick, the data on the thousands of people, tens of thousands of people who had taken the various shots and how they did in terms of the safety record. So I can report without any hesitation that the safety record, okay, the safety record of the shots has been outstanding. One of the best we've seen with any of the vaccinations before. And I know some of you, have lived through the polio era, and you may remember when they closed one of the polio factories down, and there was some contamination within the vaccine, and so people got really concerned about this. So I want to first validate your concern, Rick. And I want to say that, in the past, we have had issues with these things, and the monitoring that is now in place, and now fast forward with the tens of thousands of people that went through the trials, and now the people that are getting the vaccine after the trials, this is one of the safest vaccines that we have seen. The most common side effects are short term. People may get some headaches, may get some tiredness, may feel sweaty, a little febrile, sometimes a little bit of chills for the first day. Those are all good things. That means your immune system is working. They usually last for only a few days. We have very rarely have we seen long-term effects from the shot itself. We have seen a COVID long hauler or COVID long syndrome. It's been written about by Tom Solomon in the Lancet. Tom's from the UK, and many other authors. There is another paper in the Lancet just this week talking about neurologic symptoms of the long haul syndrome. That's much more common. That's not from the vaccine, Rick. That's from actually getting COVID. So you have a better chance of having a long-term problem from getting COVID than from getting the vaccine. We're just not seeing that. Now, there's some emerging data, Rick, that is showing us that in some way that we don't understand. And let me tell you, people that know me know I say all the time that every day that I practice medicine, I know less. It's a very humbling profession. And we have found that some of the people with the COVID long haul syndrome, so they got COVID-19 and then they have these long haul, bad effects that are lasting, fatigue, headaches, and other symptoms. They're finding that some of those are getting better after they take the COVID-19 shots, and we have no idea why that is. Now, there are small cohorts of people throughout the world that are being followed along. We're monitoring them for long-term side effects of the vaccine. And there are, folks that are going to get some long-term effects, but they seem to be extremely rare. I was interfacing with Mark Hallett at the National Institutes of Health, and they're following some of these people long-term, but it is extremely rare. So Rick from West Virginia, we don't know what all the long-term effects are, but we think that this shot is as good as influenza and as good as other vaccines that have come before. It is safe, and we're not seeing a lot of long-term issues in folks. Where we're seeing long-term issues are people who are not vaccinated, who get COVID, and who get what Tom Solomon calls the long COVID, or we call in America the long hauler syndrome. So Rick from West Virginia, you were on the board first. Thank you for being our first question here today. I want to remind everyone we're talking about Parkinson's disease in the COVID-19 era, and we want to take your questions live. So the next question comes from Amit Anand, and so Amit says, are there any side effects of the COVID-19 vaccination shots specifically for a Parkinson's disease patient? So the answer is we don't think so, Amit. We think that all of the side effects, all of the things that we see, the fever, the chills, the headache, and some people get nothing, most people only get a sore arm, are very similar to what we're seeing in the general population. And in fact, as you get older, there may be, we don't know this yet, there may be a difference between how people respond as you're older versus younger to getting a shot. And many of our Parkinson folks are older, and some of the older folks are seeing less response. And so the immune system may not be revving up quite as much, so you don't get as much side effects. So, Amit, second question today. Thank you for your question. We super appreciate it. So the next question that is asked comes in from a helpline caller, and I just want to point out to you that we have a free helpline at the Parkinson Foundation. This is 1-800, the number 4, and then PD info. Okay, and for those of you that aren't old enough, look at your telephone, and if you look, you'll see each one of the numbers has letters associated with it. So we used to spell things, with those letters, and so if you look at it, it's 1-800, the number 4, PD info. We have nurses that are available. Not around the clock, but available during the daytime hours to answer your questions. And we've taken literally just thousands and thousands. And this is the best group of nurses, and it's free, and you should take advantage of it. So another great Parkinson Foundation service. And so within the helpline, we got a call from a helpline caller who said, can the COVID-19 vaccine cause multiple sclerosis? And can it cause amyotrophic lateral sclerosis? Oh, that's a mouthful. That's ALS is the summary, and that's Lou Gehrig's disease. And so the caller wants to know, can the COVID-19 vaccine cause multiple sclerosis, and can it cause Lou Gehrig's disease? The answer is no. Okay, so no to the helpline caller. It does not cause multiple sclerosis. It does not cause ALS or Lou Gehrig's disease. So thank you for that, and a shout out to our helpline. And please call our 1-800 4PD info helpline. We're super excited to help you in any way that we can. And so we are really excited. And so the next question is from Sarah Kitchens. Sarah says that my dad died 2 weeks after he got the COVID-19 vaccine. He has had Parkinson's since 2009. I'd hate to correlate the two, and I'm a nurse. Sarah, first of all, our hearts go completely out to you, okay? Completely out to you. We have heard, through the helpline and just through talking to people around the world about cases where people get the vaccine and then people die, okay? Now, one of the things I want to remind everybody is what an association is in medicine. And we see associations. And so when we first started doing these COVID-19 Facebook Lives, we talked about associations that were popping up. One of the first ones to pop up was taking ibuprofen was causing people to die or have bad side effects with COVID-19. As we got more data, we realized the two were unrelated, okay? So when we see something that might be associated, we look at the data and we look to see if it's related or not. So all of the thousands and thousands of cases of people that have gotten the vaccine, we have not seen a statistical correlation that the vaccine causes death, and we're looking at very large numbers, okay? And so this is something that obviously is of paramount importance that we track, okay? But I want you to be aware the same was when we saw hydroxychloroquine. Hydroxychloroquine, these people are getting better. Again, the data didn't bear that out. And so far, Sarah, the data is not bearing out that the vaccine is causative of death in any COVID-19 patient yet. Death from a vaccine would cause the vaccine to be pulled from the market, okay? Now, I will point out that in the 1950s and 1955, during the polio vaccine, there was a little battle going on, Sarah, and it was between this guy named Jonas Salk, who became the director of the Salk Institute, and Albert Sabin, the Russian scientist doctor that came over. And they had two different ways of doing the vaccinations and making vaccinations. And what happened, Sarah, is there was this battle between live vaccination and killed vaccination, and we've moved way beyond that. In our world now, we're just sending the instructions in for your own immune system to make the actual antibodies, which is super cool. So we've pushed the field forward, okay? But the reason I bring up that battle between Jonas Salk and Albert Sabin is because during that battle, There were moments where we had to pause because we saw deaths. Okay? We had to pause the vaccine programs because we saw deaths. Pause them, look for contaminants within the vaccine, look for the reasons why there might be deaths associated with it. And this caused a large scale change in the way the Food and Drug Administration and the way the world looks at vaccines now. Now we do full scale monitoring, okay? So Sarah, I'm super sorry and just feel awful about your dad passing away. If the data bears out that there are, groups of vaccine patients that are dying associated to the vaccine, then we definitely need to hit pause or figure out which factories the vaccine came from, make sure there's not a contaminant or anything like that. And so we are doing as much monitoring as we can, as much monitoring has ever been done in the history of this planet for vaccines on this one, and we're just not seeing the correlation yet. But it's super important that we report these things and look at them, because if we see a pattern like they saw in 1955 and the 50s with polio, then we can put a pause on the program. So I hope that answers your question about association. And again, we have to be humble, and we've got to report these things, and we've got to monitor these things. That's the answer, and I think that's the best way for us to move forward. So again, if you have questions, Adolfo Diaz is the head of our Parkinson helpline with nurses. It's 1-800, the number 4PD-INFO. If you like the straight numbers, they're in your chat, 1-800-473-4636, 1-800-473-4636, and we'll be able to answer any question that you can at any time, not just about COVID-19. So let's move to Joe. Joe, thank you for your question. Joe is contacting us from Pembroke Pines in the state of Florida. So Joe, it's great to have you on. And Joe wants to know, will the vaccine change my symptoms of Parkinson's? Will the vaccine change my symptoms of Parkinson's? So let's think about this. Fundamentally, it would be easy for us to say, Joe, no, the vaccine shouldn't change your symptoms at all. But we're a little bit too smart, for an answer like that. The answer should be a little bit more nuanced, okay? Will the vaccine change your long-term symptoms? No. But short-term, when we give a vaccination, the idea is we're giving the instructions to your immune system so it can learn how to make that little marker, the little marker that's on the outside of the coronavirus, so that we can make antibodies against it and smash it, okay? And as we do that, we give the instructions, and the immune system gears up. That causes some stress to your body and to the immune system. Sometimes it causes your temperature to elevate for a day or two, and can cause symptoms with some pain around the injection site. So short term, you may see some worsening in your Parkinson that come onto that. Stress, anxiety, sleep deprivation, all are known to worsen Parkinson's symptoms. And certainly we could say getting a vaccine can cause a lot of anxiety, and there can be effects from the vaccine. And so it's super important. And so thank you for the question, Joe. The vaccine changed your symptoms in the short term. Most people it hasn't. We followed a lot of folks with it, but it can. Stress, anxiety, and vaccination can all short-term worsen some of the Parkinson disease symptoms. Okay, so let's move on here, because we've got some more questions here. We've got a question from Joseph, and Joseph is asking, is Parkinson's one of the expected side effects of the COVID-19 vaccine? So interesting. So when we give a vaccine for any disease, we are really focused on documenting. And in science, we call these case report forms. So every time we get the vaccine, if somebody has something bad or reports something bad, we write it down and we submit it to our regulatory authorities. And that's how we monitor it. We've also, enrolled a lot of people in these long-term studies in order to look at how can we detect this over a long period of time, Joseph. And so, for example, a lot of our students here, I'm at the University of Florida. It's the number 6 public university in the U.S. We have 50,000 students. It's absolutely crazy, the size and depth of this university. But many of our students have signed up to continue to give information about how the vaccine is affecting them over time. Many of you who aren't students have signed up for these programs through health agencies, through the government, through the National Institutes of Health to monitor you. Okay, and so when we're thinking about Parkinson's being one of the expected side effects, the answer is no, Joseph. Parkinson's is not expected. We don't expect to cause Parkinson's disease or to long-term worsen Parkinson's symptoms, with the vaccination program. So it's not an expected side effect. But if it did happen, if somebody sort of popped up with Parkinson's, then we would definitely want to know about that and document it. Right now, okay, and we don't get this opportunity that often, okay, in my career to see something roll out where somebody is getting a drug, and we're talking about millions and millions of people getting these vaccines, drug in the form of it's a vaccine. And so we monitor this like we monitor drugs, we monitor these vaccines. We see so many people, such large numbers of people getting it. It really gives us a great pulse on what's going on. And so the more people that get this, the more we can keep our pulse on the data, the more we can tell people like Sarah Kitchens what the facts are showing us that are on the ground, the more if there was a problem, we'd be able to identify it in a county and a jurisdiction. But it's amazing. It's amazing, Joseph, to know the number of people that have been vaccinated so far in this program without major statistical problems. It's really, breathtaking in terms of the number of lives that have been saved. And so thank you for the question. And similarly, Mark writes in asking, can the vaccine make my Parkinson's symptoms worse, my personal Parkinson's symptoms? Whether I have tremor, stiffness, slowness. And similar to the question from Joe in Pembroke Pines, Mark, the answer is no. It really doesn't. In the short term, you may see some short-term worsening, but long-term, it should not change. It should not change. So thank you. That's an awesome question. Okay, so let's talk a little bit about safety of the COVID-19 vaccination. And we have a question from Montana. So Montana is on the board. West Virginia's been on the board. Florida's on the board. Now we have Montana from Missoula. I've got Angie writing in. Angie wants to know which vaccine is safest for people with Parkinson's disease. Answer, Angie, all. Answer is all. They all have a very similar safety record. And so when we compare the vaccines, we compare in the United States, we're looking at the varieties that have been given, the Moderna vaccine. We look at the Pfizer-BioNTech vaccine, and now the single-shot Johnson & Johnson vaccine. The safety is really unprecedented. It's got one of the best, overall safety records, and all of these have been excellent, okay? Where we see differences between the vaccines are the following. It's a 2-shot vaccine for the BioNTech, okay, and for the Moderna. It's a 1-shot vaccine for the Johnson & Johnson. Now, we get more effectiveness against corona, against COVID-19, with a 2-shot approach. So you get a boost, to 60 or 70% with a single shot, and then you get into the 90%, which is unprecedented, okay? Unprecedented, okay? And I remember the story of when they asked Jonas Salk if they thought they, aspirationally could get a polio vaccine into the 90%, efficacy, and he was very hopeful that they could, but wasn't sure that it was possible. And we've already seen it with our first attempts here that are out. Now, the Johnson & Johnson, the effectiveness is in 60 and 70% because it's a single shot. We don't know if you gave it as a 2-shot, but it's a single shot. But what is common, okay? What is common? So this is for our Montana caller. What is common among those 3 is if you take the vaccine, it does get you out of the group that's going to have severe complications and need for hospitalization, ventilation, and decrease your mortality. All 3 will do that. Okay, so no difference in safety. The 2-shot vaccines are a little more effective, okay, but all 3 are effective in keeping you away from the long-term side effects of COVID-19. So thank you for the question from Montana. It's great to have Montana on the board. I want to just tell everybody that our comments section is open, and we're taking your questions in real time. And so I want to move now to a question live here from Pat Panuska. Pat, great to have you on. Pat wants to know, she tested positive for COVID from late December until late February, and 10 years of Parkinson vaccine. And so if the test was positive in late December, when should I get the vaccine? Okay, when should I get the vaccine? We don't have the exact answer to that question, but we're starting to get some clarity on this. And it's first of all the answer, Pat, is that if you've had COVID-19, you should still be vaccinated. That's the first question that has been settled here by the science. The question is how long does your immunity go? And so I've been following along with the Centers for Disease Control, which has some really great data on this, and they're looking at this question, and they're also looking at the question of how long, if you're with somebody who's vaccinated and with somebody who's had COVID, how long is it safe to be together without getting your vaccination? They're kind of looking at the 2 to 3 month, time scale. So we don't have the exact answer, Pat, but I would say after you've had corona, it's probably safe to wait a few months, but 2-3 months, certainly not more than 4 or 5 months. You want to go ahead and get revaccinated. And then if you look within the new CDC guidelines, it does allow you to hang out with other people who are vaccinated with less restrictions on masking and less restrictions on being indoors. And so the answer is somewhere around 2 to 3 months. And so we will hopefully keep you posted on Parkinson.org as we get more information. As you know, things are evolving quickly in the field, and we want to make sure that we get you as much information as we can in real time. So there was a point here and a question that we had someone write in about the point made in the posting that's online from the Netherlands, from the Dutch group on COVID-19 testing in older adults that are extremely frail and terminally ill, okay, in long-term care facilities, okay? Now, this is sort of an interesting point, and I want people to pay attention here to this because, it is not, the world is not a one-size-fits-all, okay? So you've seen in the United States, you've seen in Europe, you've seen all the major world leaders saying, let's focus on the elderly population, okay? And you've seen even in the United States, as they roll out, you want people above 65. You see where the highest mortality is in the elderly population, okay? Highest mortality is in the elderly population. So you want to get to them. And of course, where are the elderly population? They're in nursing homes, right? So elderly nursing homes end up being on the first wave. So then you see a piece here, a nuanced piece in the literature from the Dutch group saying, well, wait a minute. If somebody's extremely frail and they're terminal, okay, and that meaning that they're wishing to not have, all the stops be taken out to keep them alive, could be from other things, cancer, but certainly with Parkinson, maybe you shouldn't always give the vaccine, okay? And so here's the answer, okay? The answer is, in almost all cases of elderly people and people in nursing homes, the vaccine makes a lot of sense. But you have somebody that's frail, meaning that they may be low body weight and that they are, not wanting to be prolonged, artificially in any way, and they're in a state where they may not want, or it may not be easy to get them a vaccine. It may be okay not to vaccinate in this case. The Dutch group isn't saying do that every time. What they're saying is have the conversation, okay? Have the conversation. It's amazing to me how people don't talk. Talk to the family. Talk to the people. Ask, what do you think this person would want, okay, us to do? But certainly if the goal is to prolong life, okay, and to prevent the COVID-19 infection, then in elderly people, we should definitely be giving it. But there are a group of people who are terminally ill and very frail at the end of life that you can make an argument that you should talk about it before putting a shot in that could prolong their life. And so that's really what they're saying. And so I really appreciate this person for writing in and asking us to clarify that, because you can see how people would get confused. We're saying get it in all the elderly, get it in the nursing home, but there may be times when we don't want to administer the vaccine, okay, in that setting, okay. So we have another question from a helpline caller, and this question is a great one. It says, how can the vaccine for COVID be developed so quickly, and why can't the same dedication and resource allocation happen for Parkinson's disease? I love this question from the helpline caller. The reason I love this question is I wrote an op-ed for the Daily Beast a couple of months ago on exactly this question. Okay, so if you Google it, if you Google Okun and Daily Beast, you'll see we have an op-ed, and we were calling for an Operation Warp Speed for Parkinson's disease, just like we had for the development of the vaccine in COVID-19. Now, from the time that the first cases were identified in December, the National Institutes of Health, who's the largest funder of research in the world, of medical research in the world, within a week had sequenced the genetic information for COVID-19, okay? And they gave it out to companies like Moderna and said, go to town, make some vaccines, okay? And a whole bunch of companies came. Industry was really interested in helping the public. There were partnerships between government and industry, and lots of groups and lots of people that had know-how got together and said, let's go, let's make this happen. And not only did they make some of the more old-fashioned vaccines, like you see some of the coronavac that was done in China with adenoviruses, more similar to the approach that we see in vaccines for influenza. But this time around, we had know-how, okay, because we had seen the other SARS outbreak, we had seen Ebola, and a lot of our medical researchers were working on a technology called mRNA technology. And this is where a single strand, remember it's 2 strands in DNA that makes life and all the genetics. You could use a single strand to create the instruction set for how to make the capsule protein, how to make antibodies for the capsule protein. So you give the instructions to the person's immune system and let them make it. I don't know, and I would venture to guess, and we'll probably hear it when the Nobel Prize is given for this, because clearly this is going to be one of the things that is just an absolute medical miracle, that this technology worked so quickly, okay? But it wasn't because, like, all of a sudden we said, oh, let's try mRNA on COVID-19, okay? So this caller, you should know, what happened is we had been doing research in other areas, okay, research on viruses, research on mRNA. There was lots of medical research that was being funded by the National Institutes of Health, by all the other funders around the world, by many foundations. And we were able to use that information, leverage it, and create in really warp speed, this vaccination, which has really just been, absolutely stunning, the speed. And so when we look at that and we say, well, Parkinson's disease is the fastest growing neurological disease on the planet. It will double again. It's already doubled once from 1990 to 2015. It will double again from 2015 to 2040. The numbers here, our burden is going to be huge. More than the burden of COVID-19. It'll be spread out over time, but it will be more, and it will cost more. It will cost healthcare systems billions of dollars. It will bankrupt some healthcare systems if we don't make changes. And so I love this question from the helpline caller, because as we called for in the Daily Beast, we need to have an Operation Warp Speed. We need to, allocate the resources to actually get on top of Parkinson's disease. We need to do that. And just so you know, when we wrote a book called Ending Parkinson's Disease, Ray Dorsey, Bastian Bloom, Todd Scherer, and I wrote this book, and we've been sending these red cards to the White House, and you can get your red card at endingpd.org, and all the proceeds are to charity. And we first tried to send 10,000, we've now are over 20,000, and we're going to try to get to 100,000. And one of the things that we're asking for three things, and one of the things that we're asking for, just to this caller's question, is we're asking for research funding to be increased by 10 times. Where did we come up with that number? When we were researching the book, what we realized was to change the trajectory of HIV, of AIDS, which when I was a medical intern, there was basically an AIDS ward. There were all these people with AIDS and HIV, and there wasn't a great treatment, and people weren't living, and it was like a death sentence. Now it's a very livable chronic condition with excellent treatments that can drive the viral loads to zero or close to zero. This has been a trajectory change for people, and now it's become a livable condition. Okay? If we want that same sort of trajectory change for Parkinson, we should look at HIV, and we describe that story in the book. In HIV, they spend $3 billion a year. $3 billion with a B with the National Institutes of Health. In Parkinson, we're spending between $200 and $250 million a year. We're just not spending enough to have that Operation Warp Speed for Parkinson. So we're asking for an increase in NIH funding by 10 times, okay, as being important. The other two things, by the way, that we're asking for is continuation of telemedicine to bring care to the home for Parkinson persons. And that may go away when COVID-19 is gone. That is not a permanent change. We've been fighting for this change at Parkinson's Foundation and all the other foundations and people with Parkinson for over 10 years. And in the first 10 days of this pandemic, we got more done than in the last 10 years, but we could lose it all if it goes away. So we need to make that permanent. And there are certain pesticides and chemicals that are associated with the later onset of Parkinson that are still available, particularly in the United States, like TCE, trichloroethylate, and other pesticides that are sprayed, like paraquat, that's been banned in 32 countries but still available in the U.S. And there is a great article by a reporter who interviewed Ray Dorsey, one of the authors of the book, in The Guardian that came out this week. And so a number of you have been writing in and asking questions about that. So we're calling for banning these things. TCE, the chemical, has only been banned in 2 states in the United States so far. Paraquat, not only still legal, but doubling in its use. So thank you for that question. I think the Operation Warp Speed is super, super important. So let's move to Dallas, Texas. So we got Dallas, Texas. Welcome, Clara from Dallas, Texas. Clara wants to know, why are the Pfizer and Moderna vaccines 2 shots, but the Johnson & Johnson is just 1? Awesome question. And so, Clara, the answer to that is in the design, okay, of the vaccination. The Moderna and the Pfizer vaccine were designed as 2-shot vaccines right from the get-go and tested in that way. They are RNA-based vaccines. RNA is a little bit more stable than DNA. And DNA-based vaccine is the Johnson & Johnson, slightly different. And the question was, could we design a single-shot vaccine, which would be more practical and could get to more people? Now, we don't know, Clara, if you gave 2 shots of the Johnson & Johnson, if you would be able to get that the efficacy up to where the Moderna and the Pfizer are, the overall efficacy at 94 and 95% on those 2 vaccines. But remember, all 3, including the single-shot vaccine, are keeping people out of the hospital, stopping the mortality, and stopping the huge complications that we see. And so all 3 are good, but it does seem that the second shot, the first shot seems to prime and get the immune system going, with the second shot seems to really push up that effectiveness. And so it seems to be important. Now, we learned a lesson. There's an AstraZeneca vaccine that's been used over in Europe and the UK, and they kind of, I don't know if it was accidental, but a bunch of the patients only got half of the dose of the second shot. And so when you look at the first dose and the second dose and the priming, the first versus the second, and how much you're giving and half doses versus full doses, they also found as they changed the dose, they could get the effectiveness way up for that vaccine by giving the doses as one of them as a half dose. And so it's super important, and we're learning in real time here. Wish we could try all this and get all the data here faster so we would know the answers. The good news is that all 3 are working better than we could have imagined. So George from Indianapolis, Indiana. Indianapolis is on the board here. George wants to know, How long will the vaccine protect me? Great question, George. And more data is coming in, and each one of the vaccines will have to answer this question individually. Okay. The hope, the hope is that you'll get 12 months of protection, at least a year, and this could be more like a flu vaccine, where it's given once a year. It seems to be 6 months for sure, and the data is now suggesting, remember, these vaccines haven't been around for a year except for the people that are in trials. So it looks like still strong at 6 months, and then as the 1 year data begins to come in, we're going to hope that it'll get 8, 9, 10 months and at 1 year. The other thing is that the protection of the vaccine, the protection of the vaccine is a tricky question, because as a virus mutates, and remember, viruses like COVID-19, they mutate to survive, right? It's a normal behavior of a virus to change in the mutation. And so now the COVID that was around in the United States, for example, in March, is not the same COVID that's around right now. If you look at any of the major news outlets or scientific sources, the majority of what's in the United States now are the mutant. I think it's the B7 variant, but it's certainly one of the mutant variants that is now the UK variant, is now the predominant virus that's here. Now, luckily, so far, because we have taught it how to, taught the immune system how to target that protein, that sort of the little capsule thing that's sticking out from the little balls that you see when you look at the cartoon pictures of COVID. We've taught it how to get that capsule protein. It seems so far it's still pretty good at getting it, but could the virus mutate to beat the vaccine? And you'll know that when we give a flu vaccine, we give multiple different strains, and we try to guess which strain it's going to be for that year. And it could be that as COVID-19 morphs over time, okay, and as we develop the vaccines, we'll have to begin to try to guess which are going to be the predominant mutants and make sure that we have action, okay, against the mutations. And so the hope right now is that if things stay stable with the current mutants that are in, with the current data that we're seeing, we're going to get close to hopefully a year. So thanks for the question, George. Great to have Indianapolis, Indiana on the board here asking questions, and so thank you. Beth Smith is asking, will the J&J, that's the Johnson & Johnson, the Janssen vaccine, increase tremors and other problems related to Parkinson's? So similar to the answers I gave to Joe and Joseph earlier, Beth, the answer is no. Long term, we haven't seen this happen. Short term, we can definitely see worsening, particularly if you get febrile, have pain at the injection site. These can all lead to worsening of your Parkinson in the short term, but certainly not in the long term. We haven't seen that in the long term, and so something just to keep our eyes on. So Enrique, and welcome Enrique from Miami, Florida. Your family refuses to get the vaccine. What's the best argument I can use to try to convince them to get it? Well, Enrique, this is certainly a super important topic. I can tell you here at the University of Florida, we've been struggling with it as we tried to get all of our staff and nurses and everything at the hospitals vaccinated, and we're still sitting at 50, 60%. We'd like to get up into that 80% range, and it's up to us, Enrique, to convince people. It's up to us to provide the data to make them comfortable. But I was reading a great book by Adam Grant, who's one of my favorite authors, called Think Again, his new best-selling book, and he talks about how you talk to people. And I think it's the point that he makes, and certainly in vaccine hesitancy, this point is really important, is we have to respect each other. And if you go out and you say, Enrique, look, this is the data, this is what we should do, your effectiveness at convincing people is going to be very low. The psychological data from folks that work in the same field as Adam Grant shows that this is not the right approach. The better approach, the more refined approach that can convince more people to consider the vaccine, is by starting out on the right foot and saying to people, and I say it to all of the persons with Parkinson in my practice. I was in clinic just a few minutes before I got on here. I've got clinic again this afternoon. I say to everybody, have you decided to get the COVID-19 vaccine? Simple question. It's a yes or no question. And if the answer is no, I don't want it, your response to people matters. So if you say to people, look, I completely respect your point of view on this. I mean, there is an argument to be made, for not getting vaccines. And you have to tell people, I completely respect your point of view. But, I'm here with information if you would like me to share the latest information. And particularly, I have some expertise in Parkinson's, so I can tell you what the data is showing us. And we didn't have all the data when it started. We didn't have all the safety data when it started. We still don't have all the data, but each day we accumulate more data, and I'm happy to share with you what I know. And taking it from that perspective, Enrique, is a much better discussion. And more people have said, hey, I'd like to know, tell me. And I say, oh, I'll tell you if you want to know, I'll tell you what I know. I know from the Iowa group that looked at claims data that folks that go in the hospital with COVID-19 and Parkinson, 1 in 3 may not check out of the hospital. That's before the vaccine. I know now after vaccine, the people that are vaccinated very rarely die, okay, of COVID-19 related complications. The numbers statistically are close to 0. And so I know that. So I can share that information. I think that's a powerful fact. And so there's a better argument if you have Parkinson's disease than if you're completely healthy. There's a better argument for the vaccine in elderly people versus younger people. There's a better argument for the vaccine in African American people that seem to have a higher rate of complications, and we don't understand that, okay? And so we just have to help people by saying, look, we're getting the data in real time, and it's okay. It's okay to be scared. I'm scared too. It's okay to question whether the safety record is there. You should be doing that, and we should respect people for saying, hey, I want to make sure this thing's safe, and a whole bunch of people get it first and everything. Now we're getting to that point collectively where a whole bunch of people have gotten it. Let's share the data, and let people decide and respect them for what they decide. It's okay for them, to be concerned about it. People want to know, does it really save lives or not? And in Parkinson, it does. So, we couldn't say that in March, but we can say that now. And each day that goes by, as more and more people get vaccinated, that safety record will show. And we'll see, we'll see if there are issues like there were in 1955 where we have to shut down some of the factories, then we'll be able to tell them. But just be honest with people and be respectful. There's too much bashing going on. And Adam Grant, insinuates this, infers this in his dialogue, in his book. There's too much of us not listening to each other and not respecting each other. And so, Enrique, that would be the approach. That's the approach that I take in my own clinic. And a lot of people just want to know, and they say, hey, okay, hey, Dr. Okun, I know that you read a lot on this stuff and you follow the field. Either they are interested or they're not interested in knowing. But what I find fascinating is over time the number of folks that say, no way, I'm not getting it, I don't want to get it. And if you say, I totally respect your point of view, and understand, like where you're coming from. If you want information, I'm a person of science and of medicine, not of politics. If you want information, just ask me and I'll give it to you. But don't force it on them. And almost everybody wants the information. It's not that these people are somehow, oblivious or in a vacuum. Almost everybody wants to have the information. So, if you can share the information with them and have a positive dialogue and respect their points of view, I think more people will come around to the vaccine, particularly as the safety record continues to evolve. So, Enrique, great question. I'm glad that we got this covered. Zeta from San Francisco, California, going west here. Zeta, awesome to hear from you. Zeta wants to know, how worried should we be about virus variants, and does that level of worry change if we've been vaccinated? Zeta, we should be worried, okay? I'm not going to sugarcoat it for you. The mutations that happen are very common in this type of virus, okay? In coronaviruses, that's the class of viruses that is in. The type of mutations it's quite typical to see these mutations, and sometimes the mutations are easier to treat and sometimes they're harder to treat, okay? And it's evolutionary. It's kind of the way that that virus behaves, okay? It's normal for us to see mutations. As long as the virus is mutating in areas in its genetic information that are not affecting that capsule protein that we're giving the instructions of how to go and zap it, that's good. So right now, we are lucky, Zeta. We are lucky. Let me just say that to anybody who's listening. Why are we lucky? We're lucky because the vaccines still are active, okay? But the longer we give the vaccine to continue to mutate, the worse chance we have of beating this thing, okay? It's like when my son plays chess and he's winning the game, okay? He's winning the game, but instead of checkmating the other player, he starts playing around and, doing some extra moves and everything, instead of just checkmating him and ending the game. And then what happens is the guy comes back, okay? He sticks around too long and he comes back, okay? This is the same thing, Zeta, in COVID-19. It is the same thing as that chess game. If we don't put our masks on, if we don't distance, if we don't take the COVID-19 shots, okay, and enough people don't take those shots, and we let this virus crawl back in and keep mutating, eventually it could beat the vaccinations. So that's why it's so important for us to keep masking, even though we are vaccinating. We need to keep masking and we need to double down, because if we let COVID-19 hang around, it's going to mutate and it can beat us, okay? And some would say, some virologists who are smarter than me would say it will beat us if we let it hang around. And so it's not that we like all this isolation, it's not that we like all these rules, but how worried am I about the mutants? I'm very worried. Now, one of the questions that came in is, there's a lot of discussion about CDC guidelines, Center of Disease Control guidelines. And we've seen for the first time here during our Facebook Live series, we're seeing now some lightening of the guidelines because of vaccinations. This is awesome, okay? This is, where we wanted to get, okay? And so let me explain a little bit about that. What the CDC is now saying is if I am vaccinated and you are vaccinated, okay, it is safer now for us to sit inside with our masks off but distanced, okay? And certainly safe to sit with our masks off outside, okay? If we are both vaccinated, okay? It's certainly safer if one of us is vaccinated and the other isn't, but then we should be wearing masks and distancing, okay? Unless you've recently had COVID. If one of the people has recently had COVID and the other is vaccinated, the CD says you may have as long as 3 months. So that's why I came up with that kind of sort of 2-3 month notion, okay, for a little bit of lightening. And then during the holidays, we saw this, recommendation come out that, within your house, okay, certainly you're not masking within the house, within the people that you live with. And then now that we have vaccinations and people in our own house, mixing with one other family and the same family, not changing up the families, mixing with one other family, okay, is safer than it has been before, particularly if the adults in both families have been vaccinated, and certainly stay still at the 6 feet mark. And if you have unvaccinated people, having them mask or masking because you have some unvaccinated people is important. But if it's two similar households and it's the same household, okay, they're starting to lighten those restrictions. And so if you look at the CDC and you go to Google and you look at the CDC guidelines, you can follow those. We're starting to lighten up. I don't want to get too excited about lightening too much, but just realize, what are they saying? They're saying if I'm vaccinated and you're vaccinated, for the next few months, as long as the vaccine lasts, which is a lot of these questions that people have been asking, for us to get together, it becomes relatively safe. So we begin to turn a corner, okay, on this, and super important. If I have been vaccinated and I get exposed, okay, so I just got a letter here from my kid's school this morning saying there was an exposure. There was a kid in the class. If I get exposed but I am vaccinated, I no longer need to go get a test unless I am symptomatic. Okay, so the vaccine is really helping me. Okay, I should still take all the precautions, should still be masking, should still be distancing. I got my mask here. Okay, And it's super important. But the vaccine has allowed us, okay, has allowed us, to have a little bit more latitude. And as we double down in areas around the United States in particular, as we get to those 70-80% vaccinated numbers, things are going to get better. Now, remember, in Europe and in other locales, there's not as much vaccine. So it's not like we are going to be getting back together and traveling a lot, until we get all the countries around the world vaccinated. So we all have to help each other. This is a problem that affects everyone. And we should be super unselfish, and we should be thinking of it as an everyone problem and getting vaccine out to everyone so that we can get the world back to where it needs to be. This is truly a worldwide crisis. And if you're traveling, the CDC still says if you're getting on a plane, whether you've been vaccinated or not, mask up, distance up still, and try to avoid planes. They say try to avoid travel if you can't. Now, if you want to hug your grandkids, okay, and this is the one I'm going to end on today as we close out the hour. Ton of questions here. Okay, I see them from Lake City. I see them from Arizona. Ton of questions have come in that say, look, I desperately want to hug my grandkids or my kids, but it's usually the question is grandkids. Can I do it now that I've been vaccinated? The answer is yes, okay? But consider again what the CDC says. 2 households, both vaccinated, both under the same roof, safest. Might even be able to do it unmasked, okay? Safer for you to hug your grandkids, because usually it's not, not everybody lives right next to their grandkids. Usually safer for you to get back to the hugging, but continue the masking, okay? They can still give you COVID, although your symptoms may be asymptomatic or less because you have the vaccine. And we still don't know if you could carry it back to them, but it's a theoretical possibility. So safest would be to mask, but certainly hugging as soon as you've got your vaccine. Some hugs. I wouldn't say hug for an hour, but some quick hugs, to re-engage social contact is super important. And with that, I'm going to say we've seen so much worsening of Parkinson's symptoms in general during the COVID-19 pandemic and crisis. People have been isolated. People have been without, information. And so we have been really, really important, really stressing how important it is for people to isolate and stay safe. Now, as we're moving into this era of vaccinations, if you're getting your vaccine now, you can vaccinate, you can mask. I mean, if you're vaccinated and you're masked, you can start to go out and maybe re-engage in some of those classes. But again, small groups, socially distanced, keep your masks on. Maybe you can go back to the gym, especially if your gym is controlling the number of people that are in there. Distance, small gatherings, try to continue to mask, okay, even if you're working out, okay? So don't drop the masks and the distancing. But what we need to do is we need to be getting our Parkinson folks out of the house. And I can't stress this enough because we've seen worsening throughout the COVID-19 pandemic. And so vaccinations is one of the vehicles that's going to allow us to take it to the next level. So again, thank you. This is a broadcast from the Norman Fixel Institute, a Parkinson Foundation Center of Excellence. I'm Michael Okun. I'm the medical advisor for the Parkinson Foundation. I want to just remind you about Parkinson Awareness Month, COVID information, aware and care kits, PD Health at Home, and our Parkinson disease free 1-800 hotline. You can go to parkinson.org and use /events, /store, /COVID, /awareness, or just wander around on the site. We have so many free things out there for people. We've got Mindfulness Mondays, Wellness Wednesdays, Fitness Fridays. Let's get everybody out there and healthy. And if we haven't answered your questions, please call us on the 1-800-4PD-INFO, and we'll make sure that we answer all of your questions. And so thank you for everybody for writing in all around the United States. My apologies to anybody that we didn't get to your particular questions, but it's just been an honor to be with you, and just stay safe, and the Parkinson's Foundation is here to help. So thank you very much.